So why robotic prostate cancer surgery? Now, most of the patients who come to us with prostate cancer, they frequently ask us why robotic surgery is better than open surgery. So to understand this, we have to understand the anatomy of the prostate. Prostate is a very peculiar organ of 3 to 4 centimeters in size, which is situated deep inside the pelvis. That makes it very difficult to access during open surgery. Now, whenever we do any sort of cancer surgeries, not only we have to take care of the cancer control, but also give the best functional outcomes to the patients. The peculiarity of prostate cancer is that it arises from the posterior part of the prostate. So during open era, when we used to do open prostatectomy, we usually approach the prostate from the anterior surface. Hence, the area from where the prostate cancer arises was never accessible directly. Whole of the posterior dissection was done blindly. This led to gross dissection of the surrounding nerves that are particularly important for erectile recovery as well as early urinary control. Now, with the availability of the robotic surgery, we can actually go posterior to the prostate where the actual disease rises. The three-dimensional and high-definition view that it provides, we can view prostate with 10 times magnification. This helps us in identifying even microscopic disease which is situated in the posterior region, thereby allowing us to precisely excise the tissues and preserve the normal surrounding tissues that are important for early recovery. The second important goal during prostate surgery is to achieve better functional outcomes for the patients. This is primarily achieved by preserving the microscopic nerves that are surrounding the prostate. Now, these nerves are encapsulated in 2 to 3 layers of fascia, which are collectively known as denonvillous fascia. Now, this fascia is 1 to 2 mm thick, which is very difficult to identify and dissect during open surgery. Now, robotic surgery has been a game changer in microscopic nerve dissection during robotic prostatectomy. We can not only identify the denonvillous fascia, but also dissect it layer by layer and identify and preserve the maximum number of nerves, thereby increasing the chance of maximum functional recovery for the patients. Robotic surgery allows us to do precise dissection around the urethra, thereby allowing us to identify and preserve the maximum urethral length for the patients, thereby vastly improving the chances of urinary continence, not only permanent but also early recovery. Both this oncological as well as functional benefits associated with robotic prostate surgery has been proven in multiple studies involving lakhs of patients. This has led to robotic prostatectomy becoming the gold standard for prostate cancer surgery. So if you have been diagnosed with prostate cancer and are considering the best treatment option for prostate cancer, consult your nearest urologist or a robotic surgeon and discuss about robotic prostatectomy.